When we have hypermobility syndrome, whether it is truly genetic and we are working with HEDS, or it's not genetic and we're just on the spectrum of hypermobility syndromes, there's two things that, the way that in terms of how I approach it, two things that I think of and try to take care of. One is we try to basically load up everything in your body that is going to be helpful for the production of collagen. Your body is at a disadvantage for making collagen and the connective tissue that then, is in the ligaments and things like that, which is why there's the hypermobility. But it is not that you can't make it or you don't make it. It's just that you're at a disadvantage. And so we need to make sure that things like glycine, the tripeptides that are found in collagen, so the collagen supplements can be beneficial. There are different mucopolysaccharide compounds that can be beneficial for this. Sometimes hyaluronic acid orally can be helpful. Vitamin C, all of these things, we make sure that we are topping those stores up. So that way, any intervention we do with the prolotherapy or PRP or whatever we choose is beneficial to the maximum capacity, because we have given your body the basic building blocks it needs to a higher degree. So that's step one. Step two then is we actually look at the interventions for the actual ligaments. And that's where prolotherapy generally comes in, but it doesn't have to be prolotherapy. We can also use PRP or stem cell therapy, because all of those are going to be indicated to help the ligaments to heal. It's just a different strength. But the ultimate goal of all three of these things is to help the fibroblasts to produce a little bit more collagen, so that way the ligaments are a little bit stronger and you are a little bit more stable. Now, the hypermobility syndromes are a little bit different in that it's not like we are just dealing with somebody who has rolled their ankle a few times, they've had some damage, and we go in and we basically help repair that damage with the injections. With you and other patients who have hypermobility syndromes, we are going to need to compound treatments over time, again, because you're not going to produce the same amount of collagen, or the same amount of response to each injection as the normal person would. And so it just ends up being more treatments than the average patient, because your response is a little bit less. That doesn't necessarily mean that it's going to be a specific number, whether that's 4 treatments or 12 treatments. We never know before we start working on the actual issues to see how you respond. But we just generalize it to say that, hey, if you didn't have hypermobility syndrome, it would probably be less treatments, and the fact that you do have it, it may require just a few more treatments. But overall, we see really great responses in our patients with hypermobility syndromes once we get those treatments to start compounding on each other. And the things that you'll start to notice again is improvement in joint stability, which then results in the other widespread things. So if patients have a lot of trigger points or muscle tension because of the muscles are compensating for the instability in the joint, then those start to improve, the muscles start to loosen up. If you're getting anything cranially, so any of the dizziness, vertigo, anything like that, the orthostatic hypotension, those can start to improve if we are addressing and treating the cervical spine, if there's instability there. So that's kind of our two-prong approach. Is one, we look at supporting the metabolic and physiological process that has to happen in order for you to heal. And then two, we go in and mechanically also help kickstart that healing process.